Greetings, my name is Eric Njovu, the president of MUMELA. MUMELA stands for Mukuba University Medical Licentiate Association. This is an association that has been formed to look at the affairs of the medical licentiate students at Mukuba University. The association is mandated to also bridge in a gap between ML students at Mukuba University and also health science students from other institutions.
No, thank you very much.
Hi everyone. What I just performed is a cardiopulmonary resuscitation to this patient toward cardiac arrest. Allow me to introduce myself. I'm coming from the Medical Licentiate Association, MUMELA. My name is Mlenga Chongo and I'm the project coordinator of the Medical Licentiate Association. Basically, I'm going to talk about three things. I'm going to talk about the medical licentiate and the HPCZ, that's number one. Number two, I'm going to talk about the vision for the HPCZ that it has for us. And I'm going to talk about the differences between myself and the clinical officer. So this residence program, it is meant to ensure that the newly qualified doctors acquire the necessary surgical, OPGY, pediatrics and internal medicine competencies to enable them to provide quality clinical care to patients. Now, the Health Professions Council of Zambia has made numerous legal studies to protect all residents during this training. The guidelines for approval of the residence site issued under Section 76 of the Health Professions Act number 24 of 2009 of the laws of Zambia. It defines residency training and lays down the framework of residence training in Zambia. A mandatory recruitment before all registration as a medical licentiate practitioner. Lastly, I am going to talk about the differences between a clinical officer and a medical licentiate. So, what's the difference between a medical licentiate and a clinical officer? Basically, from what is stipulated and from what we have observed in many health faculties, clinical officers, they deal with first-line clinical management of a patient, and medical licentiate also the medical officers, they deal with second-line clinical critical care of the patient. So another difference is that medical licentiates have the opportunity to specialize in different specialties upon completion of their program. And for a clinical officer, when they need to specialize something, they must upgrade to become a medical officer or a medical licentiate in order for them to be performing some critical care management to patients and also to specialize in many surgical competencies, obstetrics and pediatrics, and also becoming a physician.
Hi everyone, my name is Chongomo. I'm a third year clinical science student and I'm also the financial chairperson of Mukuba University Medical Licentiate Association. Ladies and gentlemen, clinical science deals with understanding, diagnosis, treatment and prevention of human diseases through research and medical knowledge. As a medical licentiate, I'll be ordering and managing medication, therapies, treatment to help my patients recover from illnesses and also manage chronic conditions.
Hi everyone, my name is Miriam Kansawa, a second year student pursuing clinical science. So what do you understand by the term clinical science? Clinical science is a branch of medical science that focuses on study, diagnosis and treatment of diseases and disorders. So a person pursuing clinical science is known to be a medical licentiate. So I, as a medical licentiate, my duty is to use my medical knowledge and skills to diagnose and develop treatment plans for various medical conditions. For example, if a patient presents with cough, difficulty in breathing and confusion, I'll be able to tell that that person has pneumonia and I will give the benzyl penicillin.
Hi everyone, my name is Sylvia Kara, second year student. I'd love to talk about the duties of a medical licentiate. So what are the duties of a medical licentiate? One, you can suture a wound. How do you suture a wound? Suturing a wound involves you enclosing the wound for better healing, fast healing, and also to prevent infections. The other The other thing you can do is inserting a medical device into the body. What medical device can you insert? I'll talk about the lumbar puncture, where you insert the needle into the spinal cord. So lumbar puncture helps the medication or drugs to go directly to the affected areas. Another procedure that a medical licentiate can perform is biopsies. What do I mean by this? This is where a medical licentiate gets a tissue for examination purposes. This also helps to know how the disease has extended in the body. So a medical licentiate is also obliged to perform minor surgical procedures like draining an abscess, removal of a growth, and also to remove foreign bodies. So lastly, I would like to talk about where a medical licentiate is also able to assist in major surgical procedures such as brain surgery, cesarean section, and also appendectomy, the removal of appendix. Thank you very much.
I'm Wada Ostolungo, a third-year student pursuing clinical science. Clinical science is basically, it focuses on building the gap between health practitioners and patients' care. Clinical science, it also focuses on treating, diagnosing, and managing of patients with using evidence-based medical practices. One of my duties as a medical licentiate is to request and interpret lab results or diagnostic results. And other duty that I do as a medical licentiate is to advocate for patients' needs and rights. I surely say my patient's voice should be heard and be attended to. Beyond treating and interpreting diagnostic results, I will make sure I will stand up for my patient to making sure they receive adequate and standard health care that they need. I will stand for my patients regardless of their financial status or regardless of their background. Thank you.
Hi everyone, my name is Chandakawina. I'm a student at Mukuba University doing clinical science, and also I am the vice president of our society, which is MUMELA, which stands for Mukuba University Medical Licentiate Students. So my duty as a medical licentiate, I am obliged to provide communication between my patients and their family members. So this is done by me explaining to their family members about the diagnosis, the treatment option, as well as the outcomes or the complication that can come as a result of the condition that the patient has.
As the society, we really appreciate for having taken your time to watch this video. Thank you very much.